Welcome back, Focus learners, to another explainer. Today, we're mapping out the entire modern healthcare experience, literally from start to finish. Okay, let's dive into this. We're looking at the digital patient journey. It's basically a massive, comprehensive 11-stage framework that totally defines how we interact with health and medicine today.
Now, an 11-step list sounds super overwhelming, right? Don't worry. To keep things simple, we're going to logically break this explainer down into 3 distinct acts. Phase 1 is before the clinic, Phase 2 is active patient care, and Phase 3 is beyond the clinic. Finally, we'll wrap it all up by looking at the complete healthcare loop.
All right, let's jump right into Section 1, the digital patient journey. So, what exactly is the digital patient journey? Well, it's an end-to-end, continuous framework. It maps healthcare from the very first moments of prevention all the way through to your final follow-up. Historically, we kind of viewed healthcare as just a series of isolated, super stressful waiting room visits where you're flipping through 3-year-old magazines. Not anymore. Today, you aren't just a patient when you're sitting there in a crinkly paper gown. You're a patient existing within this continuous, flowing stream of data. It's a massive shift from reactive, one-off visits to a proactive, highly interconnected digital ecosystem. And honestly, it changes absolutely everything about how we experience wellness. Moving right along to Section 2, Phase 1, before the clinic. The real starting line of healthcare actually begins long before a stethoscope is ever involved, and this brilliantly illustrates that early progression. Your baseline is Step 1, prevention. That's just your everyday wellness, your routine. But then, boom, an inciting incident occurs. Step 2, symptoms. That baseline completely shatters. In our modern digital age, what's our immediate, almost involuntary reflex? Step 3, search. We consult Dr. Google, right? Tens of millions of health-related searches happen literally every single day, often resulting in a brief moment of sheer panic, let's be honest. But that digital breadcrumb trail naturally leads us right into Step 4, triage. This is where AI-driven symptom checkers or patient portal questionnaires step in to determine exactly what level of care you actually need, taking all the guesswork out of the equation. Think of it like a movie. In any good story, an inciting incident violently disrupts the protagonist's normal world. In healthcare, the initial onset of symptoms is precisely that incident. It actively, aggressively pushes an individual out of a passive state of prevention right into highly motivated active search and triage. You are suddenly incredibly focused on figuring out what is wrong. And modern digital tools, they are waiting right at that threshold to catch you and guide your next steps. Which brings us to a really critical question. How does effective triage seamlessly transition a searching patient into active care? Think about it. If your late-night panicked internet search confirms that you do need help, triage acts as this incredibly intelligent digital doorway. It tells you exactly how to get that help, routing you to the right professional at the right time and in the right format. And that brings us to Section 3, Phase 2, active patient care. Let's break down this crucial clinical sequence. Okay, so you've been triaged. Now you secure your spot through Step 1, booking. And nowadays, that's often done instantly via an app, totally skipping that awful game of phone tag we used to play. That booking seamlessly secures Step 2, your consultation. But today, a quick chat with a doctor is just the tip of the iceberg, right? It relies heavily on Step 3, diagnostics. We're talking high-fidelity lab results, wearable data streaming from your wrist, MRI scans, all feeding directly into unified electronic health records. And all this incredibly rich data synthesizes to output Step 4, the final treatment plan. It's a highly logical, completely data-driven progression from securing your time slot to taking targeted, physical action on your health. Moving from diagnostics to treatment is really the core ordeal here. Let's just take a brief narrative breather to appreciate this. This is the absolute critical pivot point of the entire medical experience. It's usually the moment of highest anxiety, sitting by your phone, anxiously waiting for those diagnostic results to drop into your app. But it's also the moment of greatest relief or clarity when that data finally becomes an actionable medical plan. Really, everything before this moment was just the lead-up. Everything after is the recovery. That naturally transitions us to Section 4, Phase 3, beyond the clinic. This post-care transition is where digital health truly shines. You might literally leave the physical building at Step 1, discharge, but digitally, you never really leave the system. Discharge instantly triggers Step 2, monitoring. Think of smartwatches tracking your post-op heart rate or automated digital check-in surveys buzzing on your phone to gauge your pain levels. This continuous, almost invisible tracking culminates in Step 3, follow-up.
This ensures the treatment actually worked, and it allows for rapid, real-time micro-adjustments if it didn't. So, the crucial point is this. Healing happens beyond the clinic doors. You aren't just sent home with a bandage, a pat on the back, and a wave goodbye anymore. No way. Through remote monitoring and structured digital follow-ups, the clinic essentially travels home with you. It extends the entire safety net of the hospital right into your living room, making the whole recovery process far more secure and infinitely more data-driven than it ever was in the past. Let's pull it all together in Section 5, the complete healthcare loop. Viewing this practically over, say, a 30-day period reveals the true massive scale of this journey. On day 1, your baseline of prevention is abruptly broken by symptoms. Fast forward to day 3, and the patient is deep into search and triage mode. The real heavy lifting, the booking, consultation, diagnostics, and treatment might cluster around day 10. And by day 30, they are navigating discharge, remote monitoring, and follow-up. It's a complete, spanning narrative arc managed perfectly by modern digital infrastructure. It's like a giant puzzle coming together seamlessly. Let's rapidly cement this complete 11-step journey in your working memory. We start with prevention, which is suddenly interrupted by symptoms. That instantly triggers search, leading directly to triage. Triage then facilitates booking, securing the consultation. Diagnostics are then ordered, determining the final treatment. Then comes discharge, transitioning into remote monitoring, and finalizing with a follow-up. Boom. 11 interconnected steps, forming one seamless, powerful engine of digital care. But I want to leave you with a final provocative thought here. Does follow-up simply end, or does it seamlessly lead right back into prevention to create an infinite loop of digital care? Think about it for a second. Once that follow-up officially clears you, you are technically back at stage 1, aren't you? Only this time, you're armed with brand new data and new digital tools, totally ready to maintain your baseline until the cycle inevitably begins again. And folks, that is the beautiful, cyclical, never-ending nature of digital wellness. Thank you so much for joining me on this explainer, and as always, keep learning.